All right, good afternoon. We appreciate everyone joining us today, and we're very excited to have Madisen with us who will present her expert knowledge on the recruitment and retention utilizing federal and state incentive programs. This webinar is being recorded and added to the IRHA resources for all of our members around the state. Just a few quick housekeeping items before we begin. As I mentioned, we're going to be recording today's session and it will be available on the IRHA YouTube channel within 1 week once the recording is processed. If at any point during the presentation you want to ask a question, please use the Q&A function. This function is accessible by hovering your mouse over your screen. It should pop up either at the top or the bottom of your screen, depending on what view mode you're in. IRHA staff will keep an eye out for those questions and will moderate for the presenters so they don't have to check them during the presentation. I'll turn it over to Lacey now. Or Madisen, I'm sorry.
Hi, everyone. Please bear with me as I am new to this role. I will do my best. Salita, feel free to jump in and correct me when you hear problems.
You got it, Madisen.
As always, we at the Indiana Department of Health like to begin with our mission and vision statement to promote, protect, and improve the health and safety of all Hoosiers, regardless of where they live, learn, work, or play. Beginning with health professional shortage areas known as HPSAs. These 3 maps were created by Lacey some time ago that show the Indiana health professional shortage area designations throughout the state. They're a little bit difficult to see, but it kind of gives an idea of where these are located, the ruralness of the state, and where those designations lie. Next. Diving right in, HPSA designation requirements. In order to qualify for recruitment and retention incentives, the site practice must be located in a health professional shortage area designation. Administrative buildings, any other sort of non-patient centered entities do not qualify as practice sites and would not qualify. Geographic high needs, geographic and population designations are what allows organizations to participate in the incentive programs. And basically what these are the different types of designations that a site can qualify for. And I'll get into that as it goes on. As a note, she has here at the bottom, medically underserved areas and medically underserved population designations are not enough to qualify a site for repayment incentives. Next. So this is a chart that shows the breakdown of the incentives associated with health professional shortage areas. Across the left, you've got the types, including geographic, population, and facility. And then the top is just the different incentive programs that are offered. So the X's are what would qualify and anything blank would not. So I'm not sure if you want me to go into more detail or if you want me to read this, but I'm sure these slides can be shared. They can be shared if that's okay after the meeting. These are just some more, and this is just some more information on the incentives associated with HPSA designation status. The health center program allows for a new federally qualified health center and FQHC lookalike access points. And then these are just the links for more information, including that for CMS rural health clinic programs, the HPSA bonus payment program, and then J1 visa waiver program. Okay, The loan repayment incentives, go ahead. Starting with the Nurse Corps loan repayment program, the eligible professions for Nurse Corps are registered nurses, nurse practitioners, and nurse faculty, allowing for up to 85% of eligible loans to be paid. And over on the right are the eligible critical shortage facility types included with Nurse Corps. It's pretty extensive. It's a great program. Next. So getting into the National Health Service Corps, NHSC, better known as, all of these, I didn't mention this. I'm sorry, this is not my presentation, so it's hard to know which ones are next. But all of the federal programs fall under the National Health Service Corps that I'm mentioning right now. In order to qualify for these types of loan repayments through NHSC, the practice sites must be in the health professional shortage areas, like I mentioned at the beginning of the presentation here. So the loan repayment programs offered are the Indian Health Services Loan Repayment Program, NHSC Loan Repayment, NHSC Rural Health Loan Repayment, NHSC Substance Use Disorder Loan Repayment Program. And like I said, that to be eligible for these loan repayment programs for your providers, clinicians must be employed at NHSC certified sites. And there's an entire application process for NHSC site certification. I am the new Office of Primary Care Manager for the Indiana Department of Health, and I work closely with Salita, who is on this call, to help sites become NHSC certified through an extensive application process that we offer technical assistance and advising for. Okay, next. NHSC sites are eligible, new sites looking to become eligible apply in the spring, and previously certified sites with expired certifications apply in the early fall. So the yearly cycles run that way. So new sites in the spring and previously certified sites reapply in the fall. Okay. So in order to meet requirements for NHSC site certification, there are a number of things that sites must comply with, and these are a few. So sites must meet specific NHSC requirements, including serving all patients regardless of their ability to pay. They must meet organization type requirements, as in it must be an outpatient facility, or for critical access hospitals, their emergency department as outpatient and ambulatory services qualify as well. And they must meet all payer requirements in addition to proper non-discrimination statements and several others. Okay. So this is an additional breakdown by profession or specialty for what providers are eligible for which loan repayment options. So again, these are the ones for actually Indiana's loan repayment program is mentioned in this as well, but these are for the NHSC loan repayment options. So I know they're a little bit difficult to see, but again, these slides can be shared once the presentation is over. So I was just talking about all of the federal programming, and we're going to be getting into the state programming now, which is the Indiana State Loan Repayment Program, which I had previously overseen before stepping into my new role. So this is sort of more my realm. Okay, go ahead. So the Indiana State Loan Repayment Program is sort of supplementary to NHSC programming. It's not as lucrative, but it is great incentives for sites who are not able to become NHSC certified. However, it is important to mention that in order to qualify for state loan repayment program, while you don't have to be NHSC site certified, you do still have to fall within a health professional shortage area. The practice site must fall within a HPSA designated area. See if I missed anything here. So applicants must be 40 hours full-time, 32 hours of direct patient care, up to 8 hours of administration work per week. And this grant is administered by the Office of Primary Care within the Division of Chronic Disease, Rural Health, and Primary Care at the State Department of Health. We just re-upped our application, so we will know in July whether we will receive additional funding. That does not require a state match, so we will be receiving additional funds hopefully before the end of summer to be able to add up to 50 participants per round for the next 4 years. That would be fantastic. Okay, next. This map shows where the SLRP recipients on all 4 rounds over the past 4 years that we have had are located. As you can see, they're primarily the more rural places in the state, and that's again because they have to fall within health professional shortage areas, similarly to NHSC. We have providers in mental health and primary care, and several professions are eligible for the state loan repayment program. So Lita, did you want to say something? I saw you came off mute.
No, am I on?
Okay, I think we're okay. Next slide is okay. No? Okay. This is a further breakdown of the eligible professions for the state loan repayment program. A little bit different than NHSC, but those are still included in the breakdown that was on a few slides before. I won't read all of these to you because you don't need me to do that, but some of the highlighted ones, which we are really happy to have and we do utilize a lot, are the alcohol and substance abuse counselors, and really all mental behavioral health as well, which includes clinical social workers. So next. Okay, apparently my name is on this. So what questions do we have? What did I miss? Yeah.
I don't see any questions come in.
Salita, did you want to add anything? I apologize that I just kind of am working through the slides here.
Hi, Madison. Can you hear me?
I can.
Yes.
Great. I think you did an awesome job covering the NHSC disciplines. So along those lines, I have nothing to add, but I'd be happy to answer any questions about those programs. Specifically, I'll be covering site applications for the NHSC, but if anybody has specific questions about NHSC, I'd be happy to do my best to answer them. But I think you cover them very well.
Thank you, Salita.
All right, then if we have no other questions, I want to thank the speakers for their presentations, and you've done an awesome job, and this will be on our YouTube site within a week. Thank you.
Thank you.